welcome to Digital Health Innovation Challenge 2023, presented by Medix Global in association with Economic Times. Medix Global called upon visionary startups, passionate individuals, pioneering researchers, and forward-thinking organizations to participate in this challenge and showcase their game-changing digital health solutions that are tailored specifically to address the unique healthcare needs of women in India. The Digital Health Innovation Challenge 2023 is the ideal platform for startups and innovators creating cutting-edge digital health solutions. This challenge focuses on tech startups catering to healthcare issues linked to women's health and mental health. These are essentially startups that aim to bridge the gap, enhance accessibility, improve the quality of healthcare, minimize unwarranted disparities in healthcare services, and promote the long-term viability of the healthcare system in India. The 2-month challenge invited entries from entrepreneurs to present their groundbreaking ideas, products, or services that leverage digital platforms, mobile applications, telemedicine, artificial intelligence, and other cutting-edge technologies. By fostering collaboration and ingenuity, this challenge aims to propel the development of innovative solutions that will revolutionize women's and mental health care outcomes in India. A panel of distinguished judges consisting of healthcare experts, investors, technology leaders, and influential figures in women's health have evaluated the submissions based on innovation, feasibility, scalability, and potential impact. Medix Global will actively support the winners in providing access to potential funding, validating product market fit, mentorship, and driving the implementation and adoption of their solutions to address the pressing healthcare challenges in India. I would now like to invite Sigal Atzmon, CEO of Medix Global, to take center stage and share the significance of the streamlined focus on women's health and mental health in this year's Digital Innovation Challenge.
Ladies and gentlemen, esteemed guests and participants, welcome to the Medix Digital Health Innovation Challenge India 2023 event. As you know from all the previous years, I'm always so proud to lead this initiative. We all undoubtedly agree that the future of India's healthcare lies in scientific progress and its digitalization, using AI, machine learning, and digital health solutions to drive accessibility, quality, and affordability of care. While our mission is to save lives and cure individuals from disease, we must always also focus on our social responsibility, on reducing inequality of care across the nation. We must all remember that healthcare is not a privilege, but a basic human right. This year's challenge focuses on 2 things: women's health and mental health, all digital. The national statistics unfortunately showcase an alarming picture with respect to women and mental health in India. India's economy has been witnessing remarkable growth. However, the participation of women in the workflow has seen a decline. In 2021 and 2022, only 29.4% of women in the working age group were part of India's labor force, a much lower number compared to the early 2000s. To further sustain and even accelerate economic growth as we would want, it is imperative to increase the participation of women, as many women as possible, in the workforce. This necessitates providing better care for women's physical and mental health, both, enabling them to overcome barriers and contribute to the economy. According to the most recent survey conducted by India's National Institute for Mental Health and Neuroscience, NIMHANS, nearly 150 million Indians, can you imagine that, require mental health care services. Yet unfortunately, only around 30 million individuals are actively seeking such care. This is a wake-up call for each and every one of us to take the initiative. And through this competition, we actually create a platform where initiative, proactivity, innovation, and technological development can come together to make a real difference in society. Over the previous few weeks, we have received, listen to this, 146 applications from startups across India, from visionary startups to passionate individuals and forward-thinking organizations, all different. A panel of distinguished business leaders here with us today have agreed to judge and have evaluated applications based on innovation, feasibility, scalability, and potential human and financial impact. Today, from the 146 application, we shall present you with the top 4 finalists, and they will offer their elevator pitches, culminating in the announcement of the final winners, who all will get one will get a cash prize, but all of them will have alongside that a splendid opportunity to introduce their solutions to potential investors and partners, with the aim of raising funds and or gaining traction through strategic partnerships and business relationships. Before scoring the finalists and announcing the winners, we are proud to also share with you a few short keynote speeches by some of India's most prominent business and social leaders. We will also have a panel of speakers to discuss some very interesting and insightful topics. Allow me now to end my opening remarks by stressing how grateful I am to have you all here with me today. Please do get ready for an inspiring and engaging experience filled with insightful discussions, valuable networking opportunities, and memorable moments. Let's do this. And now, good luck to all the finalists, and let's make this event a resounding success together.
Thank you, Sigal Atzmon, for your valuable insights. Medix has entered into a strategic partnership with Empower, an initiative of Aditya Birla Education Trust and leader in the mental health space in India that brings together a strong force of over 600 experienced mental health professionals offering world-class, scientifically proven intervention techniques impacting more than 121 million lives positively. As part of the collaboration, Empower and Medix will offer integrated and advanced tech solutions for making mental health services more accessible in India. Together, Empower, founded by Dr. Neerja Birla, and Medix, with Sigal Atzmon as the Chief Executive Officer, will change the mental health dialogue in India while promoting new ways of getting help and support. The partnership brings a new holistic approach to mental and emotional counseling and mentorship, specifically designed to reach the youth of the country. It is my pleasure to invite Dr. Neerja Birla to empower our August audience today with her insights on women's mental health and how it is key to shaping a better future for all of us.
Hello, my name is Neerja Birla, and I'm the founder and chairperson of Empower, a social organization that champions mental health in India. Today, I'd like to talk to all of you about the impact of women's mental and physical health on the economy, and vice versa. How one affects the other is an area that needs much greater focus and immediate action. For example, 47% of women worldwide are considered to be at high risk of developing mental health issues and are twice more likely than men to be diagnosed with depression. Women make up a significant percentage of our workforce. If half of that workforce is at such a high risk, it is bound to have a far-reaching negative impact on the economy. At the same time, challenging situations and battling inequality in the division of labor, pay gaps, and leadership opportunities for women, and trying to balance the various roles that they have to play, definitely leads to increased stress levels, which in turn can develop into various mental health concerns. Which means that if we were to start focusing on women's mental and physical health, we would see an immediate improvement in the economy. And this is just not a hypothesis. It is backed by conclusive data and research. Studies tell us that an estimated 300 million investment into research focused on women's mental and physical health could potentially yield a 13 billion economic return with reduced healthcare costs, better quality of life, and years of productivity returned to the global workforce. Although the concept of digital economy is a highly broad one, according to International France Corporation, women can add over 300 million to e-commerce markets alone in Africa and Southeast Asia between 2025 and 2030. At least 60% of women in Southeast Asia encounter barriers in seeing a doctor regards to family planning and services. The trauma and the mental health issues that come with unintended pregnancies lead to absenteeism and decreased productivity and economic benefits substantially. So if all the women were to have access to contraceptives, and unintended pregnancies would definitely drop by 68% globally. Again, research tells us that for every $1 spent on improving access to family planning services, society yields $120 in health and economic benefits. Gender-based economic discrimination also leads to mental health issues for women. Not only that, it contributes to a whopping 160 trillion in losses annually. Internationally, there is much greater focus on improving women's health and financial standing, as governments, especially in the developed countries, have realized the benefits of doing so. If gender parity is reduced and women could play an equal role in labor markets as men, it could potentially boost the global annual GDP by 28 trillion annually. Promoting women's health is an integral part of European Union's recovery plans. For the 21 to 26 period, the EU made the largest ever investment into healthcare, and yet they feel far more investment in women's health is required. There has been a talk of gender bonds to support and finance women empowerment, gender equality, and women's health. The SDG Acceleration Action is looking to provide innovative financing along with ICT tools and policy mechanisms for supporting women entrepreneurs. India is still lagging in research, innovations, and investment into specifically targeted solutions for women's mental and physical health challenges. I encourage all stakeholders, the government, corporates, NGOs, and citizens to come forward to help alter this landscape. For example, Empower, through its outreach arm, and now even through the app, is using digital tools to train providers and fill healthcare gaps in the remotest of areas of India. There are others like us working on several lines to bring mental and physical healthcare to the women of India in particular. But more investment is required of time, money, and innovations to bridge the gap in treatment and services available to women. The moment we invest in women's health, we will see the benefits in the economy as a whole, with women contributing significantly to it. Thank you so much and have a lovely day.
Thank you, Dr. Neerja Birla, for that eye-opening address. Digital Health Innovation Challenge 2023 is proud to partner with Indian Angel Network. Indian Angel Network is a network of angel investors keen to invest in early-stage businesses which have potential to create disproportionate value. Started in April 2006, the Indian Angel Network, in addition to money, provides constant access to high-quality mentoring, vast networks, and inputs on strategy as well as execution. The network members, because of their background, are better able to assess the potential and risks at the early stage. I would like to invite Padmaja Ruparel, a co-founder and president of the Indian Angel Network, on stage for her keynote address on how investments in the digital health space are the only way forward for India and the rest of the world to ensure sustainability of healthcare for all.
Hi, everybody. I'm delighted to join Medix. It's an exceptional cross-border platform, and I'm really, really happy that we are bringing this together. On the other hand, we have India, one of the largest demographies in the world. With a population of 1.4 billion, this country truly has a need to improve healthcare. Having said that, it is also a country with diverse needs. What works in the north not necessarily works in the South. It is here that customers are not only diverse in terms of needs, but are also very different in their pricing requirements. It is a country where preventive is equally important to curative. And what works in this country here in India can work for sure in some other part of the world. Hence, I think the India Israel partnership is seminal, bringing innovation, entrepreneurship, scale, and value creation. This is going to be the heady mix that this cross-border partnership, strategic partnership, can bring to the table. The pandemic in 2020 brought this to head, and it really emphasized the need for healthcare to be so critical. In India at IEN, if I look at it, our pre-COVID healthcare innovation applications used to be about 9 to 10%. Sorry. In a period of 3 months or 90 days, that went up to 30% and 33%. Post the pandemic, we thought the numbers would go down. It hasn't. It is still at about 33 to 35% of our applications. This not only emphasizes the focus that healthcare has taken in India, and I presume around the world, but it is also telling me something more. Innovation and disruptive solutions are the need of the day, and the startup entrepreneurs are building this. They have been encouraged further with the likes of Ayushman Bharat. The government's focus on healthcare has been exceptional. It has leveraged the UPI and the India Stack to build very innovative Ayushman Bharat platform. We have a number of products emanating out of this: insurance, healthcare, and the hospital infrastructure, not only for the top percentile of the population, but right down to the economically weaker section. But the real growth is happening in India and the domestic bulge, which is at the middle class level. The focus on curative and preventive both have really grown. This growth has happened because of the rapid digitization that India has built over the last 7 to 8 years. Becoming digital is important, but remaining digital is even more important. And healthcare has taken a leadership here. One small example. Today in India, Indians have their COVID certificate on a digital platform, COVID vaccination certificate on a digital platform. We don't nearly need to pull out a paper to show our vaccination certificate. It's on our phones. Our records, our health records are digitized. One click and we have it all there. So I think today we have an opportunity to leverage globe's largest market to bring innovative healthcare technologies from anywhere in the world. On that note, I do want to congratulate Medix for building this platform for what would be the seeds of what I think will create the best healthcare ecosystem between two countries, India and Israel. Thank you very much for your time. And I really congratulate the team of Medix for putting all of this together. And I'm delighted and humbled to be a participant.
Thank you, ma'am, for a truly enlightening address. Now I would like to invite Mr. Sanjay Kedia, the CEO of Marsh McLennan India, to take center stage. He's truly the most qualified individual to address how women's health and mental health will drive the future of India's corporates.
Very good morning, everyone. Many congratulations to Medix, CEO Siegel, and the entire team for organizing Medix Digital Health Innovation Challenge 2023. This event could not be more timely. As Mercer Marsh, we work for the corporates to help them on their health insurance across India. And what we have seen in our various surveys, including the recent survey of 2023, that the need for the employer coming out of the demands from the employees is much more beyond the regular insurance. The employees are vocal that they want to see their employer to be looking at their entire health needs in a holistic manner. It is very much part of the employee value proposition as to how they engage them and take care of them. It has gone beyond just the productivity issue, absenteeism, but it is very much at the core of what an employee expects and wants to experience. Some of the key highlights, if I want to pick up from that survey, was one, around mental health. Almost 50% of the surveyed employee population mentioned that they do feel stress and anxiety as something which impacts them in their work life. Of course, it may not be at a clinical stage, but the need for addressing stress and anxiety alone is such a big subject on the mental health. 85% of the surveyed employees also mentioned that they would like to see their employer do something specific and something tangible around women healthcare. And we could share from our experience that the whole space of digital health, the usage was around less than 10% pre-COVID. And immediately in the midst of the COVID, the usage of digital health as an instrument shot up over 70% among the corporates we serve, which is over 3,500 corporates in India. So the usage of digital health to bring out the reach, affordability, and disrupt the existing models is very widely now prevalent in India, and they are growing rapidly. So having this event with so many good innovative ideas, I'm quite excited and wish each one of them my very best to bring in what the country needs, what the employees needs, and which the larger entire society needs. So my very best wishes to Medix and all the participants. Thank you.
Now, I would like to thank Mr. Sanjay Kedia for his time. It's time for our next session, a topical panel discussion on the role of technology, digital and AI-driven solutions to ensure accessible, affordable, and quality-driven healthcare for all. The session will be hosted by CEO of Medix Global. You've heard from her, Siegel Adsmon. We have three distinguished panelists to lead the discussion today. Bala Deshpande, founder, partner, Mega Delta Capital. Bala has nearly 2 decades of experience in investment advisory, having started her investing career with ICICI Ventures in 2001. In 2008, she joined NEA to set up their India platform, where she headed the practice for 10 years and helped NEA US in investing and backing disruptive companies in the mid-market space. Prior to her investing experience, Bala had deep operational experience, having worked for about 10 years with well-regarded multinational corporations in India, such as ICI, Cadbury's, and Best Foods. Her investment advisory career spans both early and growth investing experience across multiple sectors. She has played an instrumental role in many innovative plays and entrepreneurial journeys, including the first internet IPO, first 24-hour news channel, first payments tech company, several consumer companies that redefined this sector. She is an independent board member of 2 deeply disruptive companies, that is, InfoEdge Limited and Future Enterprise Limited. During her board tenure, these companies have grown exponentially, emerged as category leaders, and created immense shareholder value with multi-billion-dollar market caps. She is passionate about technology and its far-reaching implications on markets, businesses, and consumers. She seeks to back and help build disruptive businesses and entrepreneurs who redefine markets and create lasting economic value. We also have on the panel today Mayank Batwal. He is the CEO at ABHICL, a joint venture between the Aditya Birla Group and MMI Holdings of South Africa since August 2015. He also serves as director on the board of directors for Aditya Birla Wellness Private Limited. Mayank has been responsible for setting up the latest venture of Aditya Birla Capital Limited in the health insurance space. With Mayank's expertise and experience, the health insurance business has entered the Indian health market with a differentiated business model, developed an efficient multi-channel distribution system that's leveraging the increasing digital opportunity. Mayank has a rich experience of nearly 24 years in the industry. He joined the Aditya Birla Group in early 1994 and has worked closely in various units and projects of the group, including fertilizer and copper smelting units, financial services business, and power projects. Mayank is fellow member of the Institute of Chartered Accountants of India, ICAI, the Institute of Cost and Works Accountants of India, ICWA, and the Institute of Company Secretaries of India, that is ICSI. He is also engaged with several bodies, including CII Subcommittee on the Accessibility Health Insurance, the FICCI Committee on Health Insurance, and the Internet and Mobile Association of India's IAMAI Health Tech Committee. Mayank has been the recipient of several personal and professional recognitions and has been felicitated at the annual CFO 100 Roll of Honor for the years 2012, 2013, and 2014 for his exceptional contribution to the area of corporate finance. We also have Yaron Danieli, partner and head of Amoon Alpha Amoon Ventures. Yaron Danieli is a general partner at Amoon, the largest global health tech VC fund based in Israel with over $1.3 billion assets under management. Amoon leverages the pioneering scientific research, raw talent, and do the impossible culture of the startup nation. Yaron partners with outstanding entrepreneurs who harness groundbreaking science and technology to transform healthcare and co-leads Velocity, a Moon early-stage investment fund pursuing disruptive, cutting-edge technologies with the potential to accelerate cure.
Hello, Bala. Hello, Mayank. Hello, Yaron. I'm so excited to have you here with us today and to discuss this important topic of the future of global healthcare, where it is actually going. And we all know that it actually relies on two things, I believe, and you correct me if I'm wrong. One is science, basically. How are we going to deliver better diagnostics, better treatments, but combined with really technology, digital solutions, AI and machine learning, because otherwise healthcare will clearly not be sustainable on the long run, won't be affordable and accessible to everyone. And as you know, I'm a very big believer of healthcare is actually not a privilege, but a basic human right. And as we do run businesses, we also have to think about our social responsibility, delivering healthcare for all. So I think today I'm going to do a gesture for women first, and ask Bala maybe, what is your take on the Indian healthcare system? Where is it going, and what is the impact of technology going to be as the leader of a leading Indian VC that I think, if I'm not wrong, actually earmarks a third of its investments into health tech?
Thank you, Sigal, and hi everyone. Really looking forward to this much needed panel on healthcare and technology. I'm sure Maya could agree that India is is like in many other industries, has healthcare which is either fully developed or really underdeveloped. It is the typical case of the six blind men and the elephant, depending on which part of healthcare industry you touch and who is looking at it. The perspectives can be very different. But yes, we are a very large nation, probably going and very, very underpenetrated on healthcare on many accounts. I won't go down that path. But we believe that as a country, we will leapfrog certain cycles of development because we will adopt technology faster. So it is a curious case of having very poor people with very little access to to healthcare, and having the best of healthcare practices that you can find globally in our country. So we are I would say multifaceted in both the kind of quality, quantity, as well as adoption of technology is concerned. It's very, very, very intensely, whether if you look whether hat of rural versus urban or tier one versus tier three, and similarly between the rich and the poor, and in certain verticals like women's health, mental health have only recently got prominence in our country. So
Attention.
where I see technology playing a role is really making all of this into one even surface that will become make healthcare a accessible first, b effective, because I think today if you pay you can get great healthcare. If you don't have money, you suffer. So that level playing field will is what technology will establish. And three, I think we forever have been a self-care, not insured kind of a country, which I think people like my uncle would be, are helping us getting into a very, very strong insurance, insured base play. That will also play a large role in making sure that technology gets adopted and we deliver quality healthcare very evenly across our population very well.
So would it be right to say that a very strongly growing economy, 1.4 billion people, that is not something you just wave away, needs attention in the process of transformation? And so we would agree that technology is the only thing that can bring accessibility and affordability, because India, while in the US you have to take down so much legacy infrastructure, you have to fight against lobbyism and strong associations of doctors, etc. In India, the shortage is so big, the opportunity is so big. And while we're going through modernization, I believe, and you tell me if I'm wrong, technology is key to transform and to provide that accessibility. Now, I would like one more question for you, Bala.
I would add just one point there. Technology and capital. I think this sector has seen very poor capital flows in the past. But the last decade, the amount of healthcare
They're
invested
getting a lot of attention.
is amazing, yeah. And that is going to be important too.
So on that, I have a question mark, because I see the stakeholders, I see the investments, I see the different players, I see patient accessibility, better affordability, large hospitals, outpatient trends, etc. And we'll speak about insurance in a minute. But what I don't know is what has been really, in the last few years, the ROI on healthcare tech in India specifically. I know it all around the world. I know some in India, but how secure and hopeful can we be that those investments will actually deliver exits and on top of just delivering better healthcare,
right?
but a good ROI for their investments? How has it?
Here again, I think what was done very well is what I would call the transform, the midst of the transformation, right? So if you look at what has been extremely good for capital providers is the hospital sector, right? You have a very strong footprint of hospital chains and clinics that are getting funded, that are giving an ROI above 15%, I would say, not the 24, 20, 30% that an equity provider would want, but definitely in a very strong 15 to 20% range, which is essentially because we have shortage of beds, and therefore as hospital chains and clinics penetrate outward and deeply into a city, they are getting the necessary patient inflow, etc., etc. So they're doing extremely well. But this is still the old world, right? On top of that, what is now started happening is preventive healthcare, or even a very what you would say intensely felt needs that are being catered to, whether it is diagnostics, whether it is diagnostics at home, whether it is
Home care.
oh
Yeah.
yeah. So these
Keeping people
kinds,
outside of the hospitals is a big
that's
trend
right.
and a very necessary one to reduce costs, clearly.
So those are the next wave which have started seeing great ROIs and seeing great lot of returns. In fact, I would say that as we invested in a daycare clinic, which is essentially surgery in a day and you go home, and the kind of response we got from the insurance sector was fantastic, which really helped us.
Clearly.
They make money on that. So the whole ecosystem now is starting to talk to each other. But I still think that cutting edge technology adoption
Technologies.
that you see in the US, we are far away from that, right? We have been very good at biologicals, we've been very good at pharmaceuticals, but really,
For many, many years.
nanotechnology for manufacture of pharma is not yet here. So so there that curve of innovation is still yet to be explored in our country.
On that comment, I would like to go to Mayank, actually, because you touched a very important point, and then we'll come to you, Yaron, is insurance penetration. For me, without a stronger and higher insurance penetration for healthcare, we won't have what the country really needs for. Because right now, people are self-funding themselves. Largest proportion of the population does not have yet health insurance. The numbers are growing, and I'm sure you'll share a bit around that. How do you see the future of health insurance penetration, and how do you think technology will actually impact the price of private medical insurance, and will it make it more affordable so more people can buy private health insurance?
Yeah, thanks, Sigal, and it's great to be on the panel. I heard Bala talk about the need for healthcare for every Indian, and I think that's a declared commitment from the government of India as well, that they would want access to healthcare for every Indian, because I think that's a very basic need for every citizen of any country. Funding of that healthcare becomes a very important aspect to consider, because not everyone will be able to afford the quality healthcare that everyone wishes to seek and deserves to get, and therefore the role of health insurance, like the evolution of the healthcare industry itself in India. The health insurance industry has also evolved a lot in the last 10 odd years, but I think we are at a very early stages of evolution. I mean, if I cut the industry into two dimensions. One is which segment of the population is actually getting access to it, and the second axis is what part of the healthcare cost is actually getting covered in that access, if at all, right? If you look at who's getting access, the government of India has this whole policy of funding for the healthcare cost for certain segment of population which cannot afford at all the whole Ayushman Bharat scheme. I think about out of 1.4 billion, about 600 million people will get covered in that.
It's a huge challenge.
Yes, but how do you actually make it happen is something that the government is continuing to work on. The National Health Agency is continuing to work on, lots of work happening, but a lot more to happen. The second, and after that, in the balance, about 800 odd million, I see about 400 odd million, which can afford, but up to a certain amount, which means that they need really affordable health insurance. I mean, the cost has to be low so that they can pay for it, which is again missing today. Neither the government is taking care of that, nor the private sector is taking care of, because the private sector is typically catering to the 400 million above that. So 600 plus 400, which is called the missing middle, where the even Niti Aayog has come out with a document, and then the 400 is the top 400 million is where the private sector industry is catering to, and where the penetration would be, I think, between corporate and retail together, we will have about close to maybe 150 to 180 million people getting covered, with the retail being very small, bulk of them being corporate insurance. So I think that's one dimension. This is a large opportunity in whichever segment whoever wants
So
to.
insurtech is for a good VC, insurtech is a space to be as well.
Yes, so
On top of
anyone,
healthcare.
exactly. If you look at the other axis, it's only hospital cost which is getting insured. The entire out of hospital, the OPD, home care, daycare, what Bala was saying, there's a lot of treatment which can happen on home now. Why do you need to go to even daycare centers, right?
This thing, if I may just interrupt you 1 second, and please share your thoughts on this, is the poorer people or the less fortunate people and the middle market actually go inpatient because they don't have any other access, and because they can't afford just walking in somewhere, and they wait till it's so bad, and then they go inpatient and they self-pay. Or they wait for going inpatient so that the insurance will pay. There needs to be a real significant shift, and tell me what you think, Mayank, where people have to understand that it is less expensive to go outpatient, and actually using digital solutions can impact the affordability and avoid going inpatient. Hence, it's going to impact their healthcare premiums, private health insurance premiums, etc.
Absolutely spot on, Segal. I think the primary and preventive care has to be somehow brought into the clear focus. And I think that's where a lot of technology interventions can help today, right? I mean, before COVID, if one were to do a teleconsult, I remember in 2016 in our product, we brought in a teleconsult capability powered by a health tech player. And consumers were just not willing to use it because they just wanted to be before the doctor. And in a country where the size of the medical provider, whether it's doctor, nurses, hospital,
shortage,
etc., short, you need to leverage technology. I mean, it gives you access. Sitting in the deepest part of the country, you can get access to the best doctor in the country through teleconsult. I mean, and it's technology which is powering that, right? I mean, there are other parts of the digital health kind of ecosystem which can really provide access to the best quality healthcare to the last mass at a very affordable cost. And I think that is what is required. And we are trying to work with a lot of health tech players in trying to see how we can even bring into the funding option. Because for us, it makes sense. If my consumer consumes that and it avoids a hospital event, it's a much lower cost for us than to pay for that hospital event.
You're exactly taking me to the next point. And that is, for me, a huge opportunity in India is actually VCs like Yaron, like Bala, should give the capital. Insurers have to feel, and tell me if you feel a social responsibility and not just a business responsibility, but insurers actually should collaborate, and large corporates should collaborate with those VCs and those startups to bring technology and to make it accessible everywhere. Yaron, does that work in other countries, or is it very India specific? And then we'll go back to Mayank.
I think,
difficult question. It's so different.
Yeah, it's a difficult question. First, because unfortunately, not as familiar with India as I should be.
Yet.
And it sounds like a very interesting opportunity. Except that I don't want to be the downer here in this panel, but it sounds like heading down a similar, albeit 4 times bigger, but a similar route as the US market, which is actually in a much worse situation today than it was 5 or 10 years ago. What Mayank is saying sounds to me like what large US payers have been saying, and the distrust in that's sort of a result of the very fragmented healthcare system in the US, the distrust between payers who are driven by certain incentive, certain goals, certain KPIs, providers who are driven by entirely different incentives, goals, KPIs. This thing clashes, and when it clashes, it creates 2 things. First and foremost, distrust between the healthcare provider and the healthcare payer, because they are driving towards different goals. And after this distrust, enhanced cost, increased cost. So instead of lowering cost, increased cost. And the US system is at the brink of a total meltdown, right? The healthcare system. And I think one of the discussions that needs to happen in India is how do you sort of take learnings and lessons from where the US system went, and make sure that as you push more insurance, and more decentralized care and more access to your population, you don't end up with the same sort of healthcare burden and fragmentation that the US is suffering from.
I have to quickly take you up on that. I'm willing to make a bet here live that 10 years from now, the Indian healthcare system and insurance landscape will be in a much better position than the current almost breakdown, meltdown situation in the US. And I think there's a few reasons to that, but I'd like then for Bala and Mayank to share and feedback. One is the government under Modi's leadership is actually doing so much and regulating social accessibility to healthcare for the less fortunate ones, driving digitalization and regulation that actually really forces insurance to implement certain coverages. It's very, very involved, which is very different than the completely demand and freedom of whatever you do, those big HMOs in the US, and there is not the regulation and the involvement is much lower. And I think the situation of the American system is so negatively far down the road, and India is in the process of change, of transformation. And I really think that they're learning, but then they have 1.4 billion. So that's a huge challenge, right? That no one has overcome yet in a proper way. I think the opportunity in India is actually bigger to overcome challenges and gaps than in the US because of the legacy, but they have to get it right and they have to prove it. So I'm willing to take the bet, but I don't know. Mayank, Bala.
I hear Yaun, and I think there is merit in what he's saying, which is to learn from a large market, what their learnings have been. I think there's no question on that, and I think that should be done. And I'm a optimist on India, and I would kind of go with your optimism simply because I think India is not. And that can be a topic of discussion in itself on why India is different from US. But I feel encouraged by the effort the government of India is making in putting the digital health mission in place. I know that it has had a slightly slower start than what we would have wanted, but as it gets implemented in terms of full kind of ecosystem, I think it can be a game changer, like what the the Aadhaar or the UPI has done in government services and financial services delivery, etc. I think health services delivery itself can get transformed if that program gets, and I'm hoping that it will get the same kind of nudge as a program. And yes, it is not going to be easy because in India the healthcare ecosystem itself is very, very fragmented. So the challenge is that the whole regulatory regime and the regulatory environment to deal with this very large fragmented healthcare ecosystem, which is what we find very difficult as payers to deal with. There's some work to be done in that context. So India will have its own unique challenges. But I think the big issue that we have to find is how do you provide access and then make it affordable? I think these are the two, and I think the third level will be quality. So the only way the payers and the providers can come to a common ground if finally the interest of the patient, I call it the 3P, the patient interest, because what the health outcome of the patient has to be at the center of what both of these entities are trying to get to. Like the model that we have is all about, can I get my consumer to be having a healthier outcome as a health insurance company? I remember when we started, there was skepticism, but I think that's a model to do. If we can get the healthcare delivery system, it's a tougher task than what it seems to be on the page. Then I think there could be some alignment. Otherwise, of course, there will be an inherent conflict. But the important point is that the government has decided to play the role of a payer in India. They have decided to get out of provider. And so there will be a automatic nudge and push for affordable delivery at the right cost, of the right quality. Now it is going through its own transition because as expected, there was a large pushback initially, but I think if things start settling down, the cost of the delivery, and there are already programs around value-based care and in the inherent scheme on many other aspects to take care of the quality. So I remain optimistic because of several aspects that are in play today, several initiatives, the whole program. We are a part of the healthcare ecosystem as a funder, but I think we want to play an extended role as someone who can influence as an insurance company. And I think that's what the payers have to finally evolve into.
I have another question, if I may, for Yaron, because it's been, since your last comment, it's been sitting with me. There are two things that I'm interested in your thoughts and I'm sort of worried about. So one is India being so huge, the opportunity is huge. So clearly Indian startups, the easiest way is to first go deliver services to India, because Indian people are very value driven. They care about their own nation. They want to give back. They have the opportunity to start a startup. They want to make the Indian healthcare system better. I have not seen a health tech unicorn in digital health go and become a global unicorn yet, but I'm absolutely working on it and hoping for it. We have seen India deliver exports for most of the vaccines. For hepatitis, for example, it's one of the global leaders in exports of. The world would not have hepatitis vaccines without India, a lot of pharmaceuticals, a lot of other things. But we're really looking at digital health and health tech. We don't see unicorns yet. And then there is this, okay, what do I do first as a startup? Do I tackle the very, very price sensitive market in India? But if I scale, I get profitable very fast, and the investments needed are lower to drive scale and growth and profitability. On the other side, you have the US market, way more advanced. And if you make it outside of India, you can have a probably better chance of being a global unicorn. So how do you weigh both, going Indian or going global or going to the US? And then this other, it's a maybe critical or problematic question. But in the US, you see a lot of those big tech companies that drive, they raise capital again and again at those monstrous valuations, and they lose so much money. And it's a system that nurtures itself because VCs have to make exits, they have to grow, they make loss-making deals, they grow and they grow, they are not profitable, and then at some point, it doesn't work in the favor of human outcomes, medical outcomes, the patients. So how do we balance between being a startup, wanting to create value, being profitable, and the decision between going US or this huge opportunity, way more price sensitive, difficult to scale, but if you scale it, you nail it, and you are profitable very fast at huge valuations. What would you suggest? How can you help those startups listening to us today to make the right decision?
Yeah, I think, Bala is probably. Yeah, no, it's okay. I like hard questions. They make me stay awake. I think, Bala is probably more capable of addressing some of the local issues. I'll share a couple of thoughts. On the first issue, look, very differently from therapeutics, vaccine, diagnostic companies, digital health companies are really built with the character of the market in which they're going into, right? A digital health company that is built by entrepreneurs who are identifying a need or an opportunity in the Indian healthcare market is very unlikely to easily translate to US market, Australian market, Japanese market, European market. So whereas when you have a therapeutic for obesity, it's very likely to have some sort of a use case and an impact. And so I think the decision that digital health entrepreneurs make very early in the life of the company, which is what is your target market, really dictates everything. And what we always say to people is that if you're trying to solve a local problem, stay local. If you're trying to solve a US problem or an international problem, don't waste your time staying local. And Israel has one of the best healthcare systems in the world, fully digitalized, longitudinal, highly concentrated, dramatically overruled by just a handful of payviders, an integrated payer provider system. So really a heaven to digital health entrepreneurs. And yet, if you are a digital health entrepreneur and you want to solve a US healthcare problem, you should not waste your time in Israel. You should not waste your time building prototypes here. You should not waste your time
it's too small.
implementing. What? Well, it's too small,
Because
but even
Israel
if
is
it
so
was
small.
bigger, the decision to go after the US healthcare market means you need to build it in the US. And now, so the real answer to the Indian entrepreneurs is, what are they after? Are they after a solution to the local market with the idea of penetrating, implementing, selling, maybe becoming profitable, unlikely to ever become $1 billion US dollar company, but you don't have to be $1 billion
Who said so, Yaron? Who said so? You don't have to. Sure, you have to.
You can be very rich. You can be very rich and very happy without being $1 billion company, or you want to go to the US. I think that there's a critical decision to be made early on. It sounds like the Indian domestic market is ripe for growth and success and potential profitability for businesses that are local. The issue with that, and now I'm gonna, after giving you a hard time in the last question, I'm gonna give Bala a hard time in this question. The issue with that is that it becomes incredibly difficult for international VCs like Amun, like the US VCs, like the European VCs, to be supportive of those Indian-focused, domestic companies, because we don't understand that market. We cannot be entirely helpful. For Amun is a roll up your sleeves. You see, I don't even have long sleeves, but roll up your sleeve, be very involved type of an investor. I cannot do that remotely in a market that I don't understand. The only way I can do that
you can collaborate with an Indian VC.
Exactly, either in markets that I understand, or in collaboration with a like-minded venture capitalist that sits there. I appreciate that.
I just have to say something before I go back to Mayank and Bala on what you said. Very important. We scored, and I can't say much about the scoring, but we scored quite a bit of few companies, and some of them, and I have one specifically in mind. I won't say the name, that we scored on. It has a mental health solution for young students and kids in school that has gone global. And mental health issues in schools and teachers dealing with students, knowing how to diagnose early, feel what's going on with every child. When you have a lot of children and it's a stressful environment and you have goals, teaching goals, etc. This tool that is self-help for kids, early understanding, owning your feelings, sharing them, having friends on a platform, and teachers having the tools to assess, is a global problem. So the scale of the problem is huge in India. It's huge in the US. It's huge in so many places. Why not have a great solution and then, implement it in the US as they did, in India as they did, in additional countries, and then add technology like AI, where the more messaging you have, the more the system becomes smarter and the answers to the kids and to the teachers. So I see an opportunity, and I don't think an Indian company has to go just Indian, but it has to start somewhere. And it's difficult to move from India to the US and vice versa. But I don't think the world can ignore India's health tech or insurtech or tech space anymore. And there are going to be global deals done in India. Everyone today is looking at India, and we have to see bridges between insurtech, health tech, between the global world and India. I think there is no other option. Mayank, Bala.
Yeah, so I think I would agree with all of you, but I think I would like to bring one nuance to the table, which is that, India is a very different market because of its demographics, right? The whole world talks about the great youth population of our country and the numbers of 240 million being equal to some other country's total population. But the reality is that in a couple of years from now, the total number of citizens who would be over 60, count as senior citizens, would be close to 280 million. So we are talking about very peculiar problems. Okay, we are also a country where there are chronic diseases which, like diabetes and other endocrinological diseases, which are huge and immense and have a huge impact on the quality of life, have a huge impact on how much money they spend on medication, doctors, etc., etc. So we have even the mental depression problem. While I completely agree with you that it is a global pandemic right now, and it is scary that the kind of
Impact.
impact, the kind of penetration mental depression has had, it's really scary. But I think the kind of solution that would work in India would be very different. I mean, let's take a classroom in India. Typically the students teacher ratio here is 60 to 1, or maybe worse at times. In the US, where you have much smaller classrooms, you have far much more teacher accountability, maybe such a solution would work. So I would say that without customization for local realities, health tech ain't going to work as well. I mean, yes, technology is very, very surely importable. AI is very, very importable, but I think in a large case, it is the entrepreneurs or the business purveyors in the health tech have to be very mindful of building a very market specific approach. Otherwise, it's very hard to scale.
So
You know,
basically, it seems that Bala and Yaron agree that you have to go to the market you choose, focus on it, and be the best in it. So maybe what we'll see is global VC funds knowing India because of the opportunity and having 1.4 billion and a growing economy, probably the fastest growing economy within 10 years, and the biggest population on Earth in one nation. Maybe you would invest, Yaron, as Amun, into Indian startups that will become Indian unicorns, because it's as if you invested in half of the world, or a big part of the world.
Yeah, so sorry, just if I were to complete that, you take the example of China, right? When I was in NEA, we had a China operations and an India operations, and I think we started investing in China healthcare much earlier than in India, because China is a decade ahead of us, let's say. And the reality is that we did get unicorns in China, right? You had a lot of funds that were China focused, which collaborated with global funds, invested a lot of dollars, and today you are seeing a huge Chinese innovation curve that's happening, which people are not talking about now. Whether it is IP protected, not protected, I'm not getting into that, but India can see that curve too. So while I know a lot of healthcare VCs that have started India operations, are looking at India seriously. So I would love more of them to come. I would love more of them, especially people, I mean, from Israel. I would say that people who understand technology extremely well, VCs who can bring in that, knowledge of how technology is developing. Because one of the biggest fears in anything tech, right, is that your company can get disrupted before, the end of the year. So how are you going to deal with those realities? So smart capital is the only solution. I mean, Indian capital that understands the local realities of the market, capital that understands
combined with global
technology.
tech capital.
Yeah, it's a lot of ask there, but I think we need to do it.
It's a good ask. I wanted to move away a little bit from the investment and the VC side. We have two strong investors here, but I have additional missions besides the VC world and the investment in startups. You have collaborated, and it is so important to collaborate with digital health companies, and you've integrated solutions into the insurance capabilities so that you can deliver better, accessible, affordable care. Can you tell us a little bit about examples of what you've embedded and what went great and what didn't work? And also, at the end of that, have you embedded mental health solutions already? Is it something that's on your table? How important do you think it is, and how does it impact profitability, the economy, women, because we're speaking about women's health in this challenge. So tell us a little bit about your experience as an insurer by embedding digital health solutions to drive better care and more affordable and accessible care. What did work and what didn't work?
it's a large question, and it's a long answer, but let me try and be brief given the time. See, the attempt, firstly, the whole idea is to provide access to the consumer pool, to the entire kind of ecosystem of health, whether it's physical health, nutritional, of the mental health, and of course, access to when they really need to be the doctor, pharmacy, etc., etc. And I think the fact that digital health today is at least making a serious attempt to create some of these capabilities, though I must say that I see the players still at a very early stages, and not at a stage where I find them being able to demonstrate scale up for the size of the country, because please understand that in India things work only if you have a scalable model that can scale. I mean, very few businesses will work in a very niche small, because at 1.4 billion, even a niche is like 100 million in a sense, right? So we are working on the, let's say we work with a partner where we use digital face recognition technology, for digital health. I mean, it's a quick access to
initial diagnosis
for our customers. We in fact spoke to one Israeli entity also. We really loved that Israeli entity, but one of the challenge we found was it ready for the Indian consumer patient, or and some work that they need to do with Indian, because there are aspects of that one has to be ready with, right? I think but we found there's another entity, and it's early stages, but we are seeing some good traction. We asked about mental health. We have a player which is actually providing that access on mental health on our digital asset for consumers. But the problem there is different. It's not about creating an access or creating a capability. It's about the whole taboo of using
the stigma,
mental health, and the stigma around it, where we've had conversations around how do you kind of make it really something that people are much more willing, and do you position it differently, etc., etc. That's a topic in itself. We have a partner which is trying to help on a digital health management side. Can they have leveraging bot and other technologies, and then a real person coming in at the right stage to manage disease conditions, chronic disease conditions. Again, some very encouraging outcomes, but yet to scale up. So we are finding players who are bringing in a lot of these capabilities. I think there's
starting implementation,
but I think we need some more. I don't know, some of you, if you have evaluated from an investment perspective, I don't know if Bala has done, but I think they need more both capability in terms of technical expertise, and maybe some of this global expertise to the extent and capital to be really able to invest at the scale at which they need to be to create something. Because please understand, in India, medical is still where people will be more comfortable, talking to an expert face to face, and that whole touch and feel thing. It's still people will not be very comfortable, at scale. And we saw a lot of adherence and a lot of adoption during COVID, but post COVID again, people are kind of swinging back to the physical world. So, but having said that, people have realized the power of digital health, because, as I said, it can create access which is not possible in the physical regime, especially in the Indian context, where the supply side will always be lower than the demand.
On just another last question for you, Mayank. Diabetes being a pandemic really in India, with numbers skyrocketing every year, going up and up and up, the only solution would be digital. How do you see the digital diabetes management, the day-to-day management, as part of your insurance? I don't know if you remember or but in our last digital health competition that we did, Fitterfly, which is a great Indian diabetes management digital platform, they had local investments, then Amazon invested in them. They have a great solution today. They grew significantly, and moving forward, there are a lot of different diabetes management solutions in the US and locally in India. How do you feel is this interaction between insurance, diabetes management, and this huge pandemic that's taking over India, basically?
No, it is absolutely imperative. The question is whether the whoever is a provider today, whether it's Fitterfly or other providers, are they ready for it today, or or are they evolving it? I think there's no question about it that to manage the whole issue at the scale at which it is there in India, the problem at the scale, digital health will have to play a big role, because that is, to my mind, the only way to kind of really scale it up. Now, I feel that there are aspects of core medical science which need to be kind of I think that's where I think there's some more work to be done to bring in the real science behind
Augmented.
to augment what other capabilities they have created. Technology is one piece. I agree, it's great, but how do you make sure that patients,
the science part is taken care of
behind it? And I think that's where, when those aspects come together, the consumer facing technology and the real science behind it, I think then it will grow. Of course, price and affordability will be absolute imperative.
Bala.
I think this conversation was a lot about India, but I do think that what's happening in the US and in some parts of the world is truly exciting. I keep a close tab on the technologies that are developing, and generative AI, we haven't even thought about how going to be the application. So I do think that what's happening in the rest of the world in terms of technology and the developments thereof is there is a great opportunity in India, because of the sheer population that we have, we can offer huge amount of data for training these models. So we are going to be a data rich country. So it is a great opportunity for India to to work with the world, to
True.
make India very this. And like Mayank said, I'm very happy with the role that the government is playing. But honestly, that is just the first baby step. I think we need to be far much more aggressive to adopt some of the global practices, some of the global technologies to achieve your dream, Sigal, of having accessible, high quality healthcare for every citizen of this country.
Thank you, Bala. Before Yaron says his few last lines, I want to just share, Yaron, isn't it such a pleasure and so exciting, as you're managing an early stage fund, for me it is to be in the first baby or early childhood cycle of India's getting more mature, driving technology, insurtech, health tech, digital health solution, see the population, changing and going through such a transformation, and being part of it. For me, it's just mind-blowing, exciting, huge opportunity, business opportunity, but it's a big emotional opportunity and a human journey, actually, and it's, for me, just fantastic. So up to you, Yaron.
Yeah, before I became a VC 4 years ago, I spent about 20 years being the CEO of early stage companies. And so my brain is split in half between unbridled optimism. I feel I can, run through walls and achieve everything.
Conquer the world.
But the second half of the brain is unparalleled paranoia, right? Which is you always are worried about what will happen and what if it doesn't succeed and what's my plan B and what's my plan C. And so although, Sigal, it's incredibly exciting to see, the emerging technologies coming out, the regulatory advancements, the involvement of government, the awareness that the different healthcare ecosystem players are growing around how to build a more equitable, accessible healthcare system. The paranoid part of my brain is looking at the older but smaller sister of yours in the US and always thinking, what do you need to do to avoid a 25% healthcare cost out of GDP, a completely fragmented system, a distrusting system between the payer and the provider, the federal and the national, et cetera. And one of the things I'd like to throw out there is, if you went back 5 years ago, 10 years ago, the payers in the US were as hungry as Mayank seems to be to enter into these pilot agreements with digital health companies. And they were signing all these, per member, per month, or per user per month sort of pilot fees. 5 years into this, not a single payer renewed any of these contracts because it became very clear that although all these programs show incremental improvement in quality of care, the increased cost that they cost the payer is much greater, right? And we're looking for a different balance. We're looking for big impact on quality of care, small impact on cost. And the problem with all these digital solutions is that they're the other way around, right? So there are incredible amounts of investments in implementation and access, relatively small impact. Here's where I put my money today. I actually put my money today on doctors. I actually put my money today on AI solutions, digital solutions that remove a lot of the bureaucracy and a lot of the dead time the doctors are spending, and let doctors be doctors. Let them do medicine. Let them meet patients. Let them, let them educate themselves and be the best doctors they are. Not replace doctors, not develop AI that does work that's better than what doctors do, but actually remove the back office, the coding, the reimbursement, the transcription, all that stuff. Let computers handle that and let doctors be doctors. That's the first step, in my view, of how we solve healthcare. We let healthcare, do healthcare instead of do paperwork.
I just have to say that India has such a huge shortage in doctors, in hospitals, in outpatient clinics, that it won't have a choice to use digital because otherwise there won't be any healthcare. So I think the situation is very different. And another thing that speaks for India is that India is very, very good in keeping prices under control. And the US is very, very bad at doing that.
That would only mean, no, that's not true. The US is pretty good at it, except that in
the baseline is madness.
In 2022, 99.5% of hospitals in the US are bankrupt. They're losing money. And if you guys want to get to the same place in 5 years and have to shut down your hospitals, that's your choice. I would recommend doing something a little bit different than what the US did.
Absolutely agreed. And to me, last one, it is not opening more and more hospitals. It's delivering alternative solutions that augment doctors, augment payers, augment patients to have more affordable, less expensive access to care, and not just in hospitals. And because India, or take it Indonesia or any other country of large scale that doesn't have the US infrastructure, cannot even afford to open enough hospitals to cover its needs. So it has to bring in new technology, new solutions to support the doctors to deliver care in a different way, which is outpatient and not inpatient. So I think the exciting thing is learn from the US, learn from India. Everyone has to take something from everyone around the world. And more excitingly, I think we had a great panel today. We agreed we need a bridge between global and India. The world needs to understand India better, and India needs to learn from the world. I think InsurTech and HealthTech are the two really industries and areas to look at where huge progress and exciting developments and transformation is going to happen. We also all agreed that higher insurance penetration, better quality of care, affordable, and capital needs to support all that. So we have a bridge. We understand we need capital. We understand we need a strong Mayank-led insurance tech space and insurance space with all their other players. And we need all the knowledge of the world that people like Yaron have and hold, the experience, the knowledge, the capabilities, the track record to share and to collaborate with Indian ecosystems to not make mistakes and to bring in capital, but without the mistakes and doing it right. And by that, I cannot but just be hopeful that we all do it right. And India will be an example for a healthcare landscape that in 10 or 15 years, we can look back and say, well, we've done some mistakes and we have some pain points, and this we've done wrong, we should learn, but we've done a lot right, and we're going in the right direction. Servicing 1.4 billion people, that's a challenge. Thank you, everyone. so much for being with me today. We like to agree, we like to disagree, but we like the challenging conversations. Thank you so much. Have a wonderful day
Thank
today.
you, everyone. Thank you. Thank you so much. Thank you. Take care.
Now, that was a very engrossing panel discussion, serving us with a lot of food for thought. Now it is time for the finalists. We received close to 150 applications from startups across India. Getting them down to the top 4 was indeed a difficult task. Our eminent panel of judges included healthcare experts, investors, technology innovators, and influential leaders in the women's health space. You've listened to some of them today, but I would like to take the opportunity now to introduce all of our judges that are there on our eminent jury. Sigil Atzmon, CEO, Medix Group. Sanjay Kedia, CEO, Marsh McLennan, India. Neerja Birla, founder and chairperson of Aditya Birla Education Trust, founder and chairperson, Empower Minds. Gordon Watson, Chief Executive Officer, Asia and Africa, AXA Group. Seema Chaturvedi, founder, sponsor, managing partner, investment committee member, AWE. Naveen Tahilyani, CEO, Tata AIA. Padmaja Ruparel, co-founder, Indian Angel Network. Shankar Narayanan, founder and managing director, Sanaka Capital, previously managing director and co-head, Carlyle Group, Asia. Bala Deshpande, founder partner, Mega Delta Capital. Yaron Danieli, partner and head of Amoon Alpha Amoon Ventures. Sudha Shivkumar, President, Vicky Ladies Organization. Mr. Ajay Nanavati, the Chairman, Quantum Advisors. Professor David Zeltzer, Global Medical Director, Medix Group. Mrs. Annette Bernstein Reich, Chief Executive Officer, BDO Consulting India, Israel Investment Banking. The eminent jury has now curated the top 4 finalists based on a specific criterion that included market opportunity, value proposition, the business model, and customer validation. It is my honor to announce the top 4 finalists, and a very big round of applause and congratulations to all of them. These finalists are in no particular order, and they are Numi, My Healthcare, Noura Health, and Jumping Minds. Now, I would like these companies to come forward with their elevator pitches, starting with Aditi Mittal, who is the co-founder of Numi.
Hi, I'm Aditi Mittal, co-founder of Numi Care. We are a full-stack women health company prioritizing women health and solving for it at scale. My background is in fashion. I have worked with Sabyasachi Mukherjee for 15 years of my life as head designer, and I built the brand from scratch to what it is today. I, along with my husband Sanchit Agarwal, started Numi in April of last year. Sanchit spent 22 plus years in finance, health, and insurance, and in his last roles was a partner at Deloitte and global MD at Accenture, leading a $2 billion P&L. We left our careers at its peak to solve for women health. In our journey, we are joined by an outstanding founding team and medical experts, SKOLs, and advisors to guide us. So why Numi and why women health? I am a 2-time cancer conqueror, the first time at the age of 25, and 10 years later, fast forward after the birth of my son. Second time, my cancer could have been prevented. We as women need more attention because of the hormonal imbalances that happen in our body from first period to the last, which determines a large part of our health life cycle. And 60 to 70% of our health issues are completely preventable and curable. At Numi, we are solving for broken women health journey, fragmented ecosystem, lack of preventive and proactive care, and dropout of women at work due to health and wellness issues. We are India's first omni-channel women health life cycle management platform, solving for women's health journey, puberty to menopause, and preventive women cancers. Numi provides market-first human plus tech-enabled solution for women, delivering personalized journey-based care covering all health and wellness needs. We provide clinical and non-clinical solutions covering consultations, diagnostics, holistic wellness, women health product marketplace, health trackers, journey management, education, and awareness all in a single interface. So we go to the market via multiple channels. First is B2B2C via insurance, insurance brokers, and corporates. We have launched 4 structured women at work care plans and market first women OPD product with a leading insurer. And some of our marquee clients include Amex, Philips, PepsiCo, PwC, BDO, etc. We work with some large insurance companies and brokers like Aditya Birla, ICICI Lombard, Aviva, Marsh, WTW, etc. And second is our direct to consumer via phygital solution, in clinic offerings, plus digital platform based services. We have DOCO clinics, doctor-owned company operated, where we drive the entire ops, tech and human resources in these clinics. And eventually we will be opening our asset-light clinics in non-metros and tier 2, tier 3 cities. In a year since launch, we have 13,000 plus users, launched multiple market-first solutions, market-leading 40% plus retention, and projected revenue of $500,000 this year. We are a profit with purpose company, and we want to establish NewMe as the most trusted and go-to brand for women's health and build India's largest women health focused ecosystem and enable women to take control of their health. Thank you for your time and attention.
Thank you very much for that, Aditi. Next up with this elevator pitch is Shato Raha, who is the founder and CEO of My Healthcare.
Hi, I am the founder and CEO of My Healthcare. Just to quickly introduce My Healthcare and why we do what we do. Our focus is to use the use of technology and digital technology more specifically to improve the quality of healthcare in India and globally. We use data-driven care pathways as well as the entire CDSS to our advantage. In terms of how we have achieved what we have, where we are today India's largest healthcare actuarial platform, and our focus has been to build a centralized healthcare ecosystem. We focus on 3 very core pillars: centralized patient records, use the data-driven care pathways, and then finally map the entire process from diagnosis to delivery so that we can manage the patient care continuum. In terms of what we do, we manage care across 130 hospitals today. We do about 450 surgeries per day. We do about 950 admissions per day. We have about 7,000 consults going on per day on our hospital, and we are almost processing 1 diagnostic test every second. In terms of the total amount of patients being done, we are almost managing about 32 million patients on our platform. We are a pan-India company today with our technology solution deployed across hospitals across the country. We manage close to about 16,000 beds today, and which is estimated to grow to about 111,000 beds over the next 2 to 3 years. Some of the big brands that are working with us, including our hospital partners, home care providers, device integrated partners, diagnostic solutions, and clinic research partners. So they are all part of the ecosystem, and the whole advantage is this is all connected into one centralized platform. In terms of an architecture, as you see, My Healthcare is at the center of it. We have hospitals, clinics, pathology centers, radiology centers all plugged into it. We're also introducing healthcare financing for patients, which will be rolling out later this month. I just want to quickly show you a little bit about the platform. So in terms of the solutioning that we have all our patients over here on the platform right now. When I start the consult with the patient, I get to see everything about the patient. I also get to see all the information about the patient and the entire longitudinal history of the patient. So just to give you a sense of it, when I do view all, I see the complete patient charting history, including the data that the patient may have inputted. I get to see the complete longitudinal trend history of this particular patient, whether I want to go down to a week level. I also get correlated data. So for example, when a patient took 1 unit of insulin, what was the blood sugar reading? This allows us to give the impact of medication view to the doctors. I can go ahead and then also look at similarly all the lab data that is available. And all that lab data can also be viewed as patient longitudinal history over a period of time. So that again, doctors are able to take the decisions based on the same. Most importantly, we'd like to show you how the entire CDSS works. So we're going to use our voice to text, and you will see, please keep an eye out on the diagnosis area. You will see how this works. Patient has had fever for the last 4 days. Patient fever for the last 4 hours is 102 degrees Fahrenheit. Patient is hypertensive, suffering from type 2 diabetes and using metformin. So as you can see, basis this information, what the system has done is it is on the right-hand side populated all the possible diagnoses, analyzing the full history of the patient vitals history, their entire clinical history. It was also sequenced for the doctor basis their treatment habits on the highest possible care pathway to the least possible. So if I take, for example, fever, you will find that the entire care pathway is done. So all the doctor has to do is select all and confirm. It drops everything into the prescription, and you can just say follow up after 3 days and print in complete. So what this does is all the various pieces that the doctor needs to do. Now, how this helps and why is it? One is that you get very rich clinical data and longitudinal data. So even if the patient goes outside the My Healthcare ecosystem, you will see the kind of prescription that they walk out with. So they go out with, first of all our documents are QR coded so that anywhere across the ecosystem, if this QR code is read, the entire patient history is populated. We also populate all the known allergies, existing conditions. Everything that we populated over here is also populated and then sent off to the patient. Now, you see the signature, and this is how it is completed. So this is to give you a quick view of it, how it is completed in terms of the entire OP journey of a patient. We also have remote patient monitoring, where from a centralized command center, once a patient is patients, wherever they may be across the country or wherever they may be across the globe. And here again, from a centralized command center, the doctor has a full view of this patient and can stay connected with the patient wherever they are, including what's happening with them, what are the medications they are on, what are the progress notes that is happening by the care team. They can look at all of that. So if you just have a quick look at, for example, the view all of this, you'll get a sense of what are the various things that is happening with this patient. So this gives you a quick synopsis of how this entire ecosystem works. I'll just quickly come back to our presentation, just share the last few slides. How we've impacted is we've been able to increase productivity by 76% across the clinical ecosystem. In terms of the training, which is because there's high attrition in hospitals, we've almost saved 88% in training time because of the way that the entire system is architected. And most importantly, we've been able to reduce medical negligence, medical administration errors, and blood transfusion errors. We're down to 0% across the entire network that where our platforms are deployed. Lastly, I will leave you with this slide. This will give you a sense of a real-time data analytics of a patient who came into one of our hospitals, how they were treated, what were the various platforms that came into effect. And at the end of the day, we've been able to track right from the correlation of medication to the vitals, and including surgical intervention, post remote patient monitoring, and post-discharge. So this is what the entire My Healthcare ecosystem does. And our hope is that this technology solution, as we have deployed this across India, we now plan to take it across Asia, Middle East, and to the larger part of the world. So thank you very much. And we hope you will select My Healthcare to win this award.
Thank you so much. Next up, we have Sriram Ramasubramaniam, who's a technology lead of Noora Health.
Hi, my name is Sriram. I work at Noora Health. Imagine a world where every woman and caregiver has the tools and the resources to save lives. That is Noora Health's vision. We're not just another healthcare nonprofit working to empower caregivers. We are a movement that believes in the deep-seated knowledge that families and caregivers are really the ones who care the most about patients. And we believe that empowering them and giving them the right tools and the resources to do that job will go a long way in reducing the healthcare burden of our country, especially in a country like India, where healthcare resources are already strapped, healthcare workers are already overworked. We believe in leveraging the power of the family, the ones that care the most about a particular patient, to use their time and to use their knowledge to actually improve and save people's lives. Our journey starts in healthcare facilities. We train nurses and we train healthcare staff to hold group sessions where patients attend immediately after a consultation or during a consultation or when they are waiting for a consultation, essentially giving them information about the specific condition area that they are there. Our focus right now is on mothers and to-be mothers who come in to the hospital for a checkup or come in to ask any questions or just to talk to their doctor about their condition. This is where we try to give them our training through healthcare workers, where we teach them on how to look for high risk signs in their children, what to eat, what kind of nutrition they should be having, what are the things to avoid, what are the kind of healthy behaviors that they need to make sure to follow to make sure that they have a healthy pregnancy and a healthy post-delivery experience. Now, our intervention comes in two parts. One, like I said, is the one that happens in the hospital. And the most important part, and this is where I think our intervention is revolutionary, is that we continue to support them beyond the walls of the hospital through the use of mobile phones. Now we know that mobile phones, using mobile phones and cutting edge AI technology, what we try to do is send them actionable videos, reminders, relevant information, customized information that is specific to their medical condition, and based on the data that they have provided us through their healthcare journey, we try to give them the most relevant information that actually helps them identify high risk condition areas, when they need to visit a doctor, when they need not worry about this being a critical condition, and when they need to actually seek help. So our engagement using digital technology extends to a few months for post the patient comes to the hospital and goes back home. And using like I said, using AI and ML technologies like large language models, sentiment analysis, etc., we try to cater to the most to cater the patient in the most relevant context that they can understand. So we try to cater to them in the relevant language that they speak in the kind of tone that they speak in, with the kind of terminology that they speak in. So we try to engage with, and we make sure that when patients are interacting with our digital service, we are always available 24/7. And we always make sure that our service is running and our service is always available and approachable for women to actually ask questions or seek help and receive healthy reminders. We also have a flagship tele-training program where we provide one-on-one support to our highest risk mothers. So using ML technologies, we identify which are our highest risk mothers and who require the most help, and we provide one-on-one training through our tele-training staff to provide them mental health support, to hear them out for what their problems are, and provide them healthcare advice on what they need to do to ensure that their baby's health is not at risk. And given the kind of reach that we have tiered our intervention, so to speak. So based on the risk level, we make sure that the right kind of patient receives the right kind of support, so that the highest risk mothers get the most attention, and the mothers that don't need that much support are still able to get the information that they want, but without too much of a resource suck at our end. So our impact so far has been pretty immense. Women now step up with confidence, leading to shorter hospital stays, reduced readmissions, and healthier lives for their babies and themselves. So that's what we do at Noura Health. I hope you join us, and I hope you join us in this journey to revolutionize healthcare and also create a world where every caregiver has all the tools necessary to make sure that the people that they love are taken care of.
Thank you very much for your pitch, Sriram. And next up, we have Ariba Khan, founder and CEO of Jumping Minds.
Hi everyone, we are Jumping Minds, India's most loved mental health platform. We are supported by Mankind, including other several institute investors. The Jumping Minds founding team comprises of myself and Piyush Gupta. Piyush and I have known each other for the last 13 years, and together we bring over 2 decades of healthcare and technology expertise. Apart from that founding team, Jumping Minds also has Rohit Chanana as his advisor and a team of over 50 plus members. As you know, the mental health market has immense potential and is rapidly growing. However, there are 6 critical challenges, the primary being lack of mental health professionals, low engagement and retention, as well as high cost and stigma. Coming to Jumping Minds, it was during COVID-19 pandemic that Piyush and I were inspired to build a platform that will be affordable, accessible, as well as celebrates mental health and wellness. In April 2021, we launched Jumping Minds as an anonymous and comprehensive digital mental health platform that combines artificial intelligence and a humane touch to deliver personalized care. Our Novel friends therapy approach enables users to anonymously find and connect with like-minded friends, support groups, as well as experts. This results in a unique, non-judgmental, safe space that promotes connection, which is often missing in the traditional mental health solutions. Adding to that, we also have mental health experts, digital workshops, self-care tools, and Snuggles AI bot to provide solutions across the entire mental health spectrum. This results in a highly engaging, highly scalable, and anonymous platform that is available around the clock at affordable rates. We also have customized packages for women and corporates for a healthier, happier, and quality life, including attrition management, employee productivity enhancement, maternity and fertility counseling, postpartum therapy, including many others. In the last 2 years, coming to traction, we have grown to 1 million plus users, 1.5 million plus sessions, and 100 million plus brand reach. In terms of engagement, we have consistently witnessed 3 times best-in-class user engagement, retention, and repeat rate in terms of 39 minutes of daily engagement time, 44% retention, and 52% repeat purchase rate. We have also achieved 3.5% paying user conversion and over 20 LTV by CAC ratio. This helped us also raise $1.3 million of funding in year 2022. In terms of impact, we have 85% feel better rate, and we have also enabled 100,000 plus livelihood through the earning mechanism on the platform, where you can contribute to the platform and keep earning. We have also been awarded 7 times. In our journey, we have had to overcome several challenges, the primary being overcoming stigma and positioning mental well-being as cool. We did this using our brand strategy of humor and wit and depicting mental health in a relatable fashion. This was an instant viral hit and helped us reach 100 million individuals organically. The second was to maintain quality and safety at scale. We engaged artificial intelligence and natural language processing for the same. We employed 3 engines to ensure better matching of users, ensure safety on the platform, and personalized recommendations. As a way forward, we plan to grow aggressively by first launching into international markets, primarily APAC, UK, and North America. Second, launching our AI wellness dashboard that would democratize mental health and allow institutions and individuals to track their mental health in a real time, as well as launch more inclusive mental health insurance products across the categories. Thank you.
Now that concludes those exciting elevator pitches, and I have to say they were both impressive and inspirational in equal parts. Now comes the tough job for our esteemed judges. They're going to huddle together and try and evaluate these pitches. They're all perfect, but there has to be a winner, and the judges are going to do right that. They're going to get into a huddle, and we're going to have a winner for you in just a few minutes from now. Request you all to wait with us while we come back with that exciting announcement. Thank you for staying with us, and here we are at this very exciting juncture. The judges have completed the scoring of the 4 finalists, and let me tell you, it has come right down to the wire. Just a few votes differentiate our runner-ups from the winners. So let me begin. At 3rd place, we have Numi as the 2nd runner-up. Congratulations to Aditi Mittal, Sanjit Agarwal, and the Numi team. Very, very well done, and absolutely fabulous job. Now at 2nd place, as the 1st runner-up, we have My Healthcare. And congratulations to Shato Raha. You missed by just a whisker. Good work, team My Healthcare. And on 1st place, the winner of the Medix Digital Health Innovation Challenge 2023 is Jumping Minds. Congratulations to Team Jumping Minds. Before inviting Piyush Gupta, who's the co-founder and CPTO of Jumping Minds, I also want to share a mention for Noora Health for all the very important work that they're doing to advance health literacy and increase access to care. The judges were very impressed by the work you've been doing, Noora Health, and they wish you all the very best. Now it's time for me to invite Piyush Gupta, who's the co-founder and CPTO of Jumping Minds, to share a brief winner's speech with us.
Hi everyone, I'm deeply honored to stand before you as the winning startup of Medix Digital Health Innovation Challenge India 2023. Thank you so much for the opportunity and giving us this award today. Our journey with Jumping Minds has been truly a remarkable one, to be honest. And I would want to express our heartfelt gratitude to all the judges, to the entire team at Economic Times and Medix, and all those who believed in our vision so far. During the COVID-19 pandemic, Ariba and I were inspired to build a mental health platform that would be not just affordable, accessible, anonymous, but would also celebrate health and mental health and wellness. In the past 2 years, I am really happy and touched to say that Jumping Minds has been able to touch the live over 100 million people so far, making 1 million individuals happier. Our digital health solutions have bridged gaps in mental health and well-being, offering remote consultations, personalized treatments, and a 24/7 friends community for you to talk to, right? All aimed at improving the quality of life of of our customers and individuals. Going forward, we plan to democratize mental health and well-being services through innovative technology and insurance products. Um, to be honest, none of this would have been possible without the dedicated Jumping Minds team. All of them are right beside me, beside in the beside room, and are really happy about the announcement. To be honest, their passion and commitment have been the real success, for us to get here. But this, in the end, to be honest, it's just the beginning. With the continued support of our investors, our partners, and the belief that we have that innovation can transform lives. Technology is the one thing that can take us forward in our healthcare journey. We are super excited to create an even greater impact in the future. In the end, I would just like to thank the judges, Economic Times, Medix, and everyone who supported us today, in the event. Thank you so much for all your help and your recognition. I would just end the entire thing by saying that let's together shape a healthier and a happier world for everyone out there. Thank you so much. I think that would be it.
That was a very exciting and fitting conclusion to Digital Health Innovation Challenge 2023. Now I would like to invite the woman who made it all possible, Sigil Adsmon, CEO of Medix Group, to share her final thoughts and closing remarks with us.
Ladies and gentlemen, thank you so much for joining us today. It has been, to me anyway, an inspiring event filled with valuable insights and really meaningful discussions. As we bring this event to a close, let's carry forward the knowledge and the insights that we've gained here today to make a positive impact in the Indian healthcare sector, especially related to women's health and mental health. I take this opportunity to mention a quote I recently saw, which makes me so emotional and really does make sense and leaves a lasting impact. Mental health is a journey and not a destination. And healthcare is not a privilege, it's a basic human right. Both quotes are really meaningful for me. Thank you once again to the winners, to the esteemed judges, and to all of you for joining us. The journey doesn't end here. It is just the beginning of a greater collaboration and bigger achievements. Until we meet again, thank you all so much and have a good day ahead.
Thank you so much for that, ma'am. With that, Digital Health Innovation Challenge 2023 draws to an end. But we'll be back with another inspiring initiative very soon. Thank you for joining us today. We couldn't have done it without all your support.